This afternoon, we're getting answers about a decision that could allow a 15-year-old in Oregon to get a sex change without the consent of a parent.
This is suddenly an issue because Oregon's tax-funded health plan began covering transgender-related health care in January. Tonight, Chris Woodard is getting answers, and he joins us from the newsroom with more on this.
Yeah, and the transgender-related coverage, that's not something brand new. That was decided last year. It took effect in January. But today, a headline that's making its way across the web is stirring up passionate arguments, so I went to get some answers.
It's irrational. It's laughable.
Jen Burleton is the executive director of Transactive Gender Center in Portland.
And trans kids are under attack. What do we do? Rise up, fight back.
She says the idea that a 15-year-old kid can walk into a doctor's office, say they want gender affirmation surgery, and quickly and easily get that done without a parent's consent is unrealistic.
You know, it's one of those things that rational, logical people would, of course, not jump to the conclusion that that is not the process.
But today, a report by another media outlet and a press release by Parents' Rights in Education raised concerns, asking, why has the Oregon Health Authority done this? Who is pushing this agenda? I went to get answers.
Why not add additional age requirements for this coverage?
That's such a great question. So the age of consent in Oregon has been 15 since 1971. It would be a separate but equal implementation of it to say, well, for all other medical, physician-recommended medical care and evidence-based medical care, youth in Oregon can access that at age 15. But for this one, they have to wait longer.
I also went to the Oregon Health Authority. In a statement, they say, in Oregon, the age of medical consent is 15 or older. Patients should be able to demonstrate the capacity to make a fully informed decision and to give consent to treatment, regardless of age. However, nothing in Oregon law requires a healthcare provider to provide medical services to a minor or safeguard the confidentiality of a minor. In most cases, providers will encourage, and in some cases require, family engagement and supports, unless it would endanger the patient. I also found a long list of guidelines that must be met before anyone gets insurance coverage for sex reassignment surgery. And I found psychotherapy and medical and surgical treatments for gender dysphoria listed as 413 out of 476 in a list of prioritized health services the Oregon Health Plan will cover. It is coverage Burleton says she worked hard to secure during testimony in front of the Health Evidence Review Commission last year.
That showed that this care was indeed life-saving. It was medically necessary. There was evidence. It was evidence-based care.
So Oregon Medicaid began covering transgender-related health care in January. And for years, the age of medical consent in Oregon has been 15. Combine those two, and you have this issue that some are now voicing concerns about, even if that wasn't specifically tied together as an intended outcome of the January change.
So just hypothetically, if there was a 15-year-old that wanted the surgery, from reading the guidelines, still they would have to have 12 months of hormones. They would have to live as the other gender for 12 months. They would also have to have 2 psychotherapists who deal with transgender issues approve the surgery. So there's just, as you mentioned, many steps before this theoretically could even happen.
A lot of counseling, many different sessions, not something they say that someone could walk in and get it a week later.
Thanks
right,
for
Chris.
breaking that down, though, for us, Chris.